Okay, thank you, Michelle. We're very excited tonight to have two marvelous speakers of our own from NAPNAP. Our first is Laura Searcy. She's our past president of NAPNAP. She's a veteran pediatric nurse practitioner with a great passion for children's health and well-being. She has an extensive experience in primary care and as well as child and adolescent injury prevention, substance use prevention, child health advocacy, government affairs, and nonprofit board governance. Very big resume. She served as the chair of the NAPNAP Health Policy Committee from 2014 through 2016. She was the co-founder and the first legislative director of the Georgia Coalition for Advanced Practice Nurses, Registered Nurses, and she received the 2014 AANP Nurse Practitioner State Award of Excellence in Georgia. She was selected as an AANP Fellow in 2018 as well. She is an experienced public speaker and frequently presents on a variety of clinical topics, professional and leadership topics at the state and national and local levels. She recently co-authored a NAPNAP position statement on the use and exposure to tobacco products in children, adolescents, and young adults in just this year, in 2020. And additionally, Laura has extensive nonprofit board work experience, including serving 3 terms as the elected member of the Cobb County, Georgia Board of Education. She frequently serves as a consultant about preventing youth initiation of tobacco products for the Georgia Department of Public Health and the Department of Behavioral Health and Developmental Disabilities. So welcome, Laura. And we have our second speaker is Lacey Eden. She is a board certified family nurse practitioner who's currently working in primary care in South Jordan, Utah. She's a former associate teaching professor at the College of Nursing in Brigham Young University. Lacey is dedicated to educating others about the importance of vaccines and has served as an advisory consultant to the number of organizations, including the American Cancer Institute's HPV Roundtable Communications Committee and the Immunization Action Coalition. Lacey is a former chair of the NAPNAP Immunization SIG, and she has liaisoned to other groups on behalf of NAPNAP. She has written numerous publications in the areas of immunization training, vaccine education, health, child health advocacy, and improving immunization rates, and immunization exception education and advocacy. She works at, has been presented at international and national meetings, and she received the 2017 NAPNAP Grassroots Award for her work on childhood vaccine advocacy. She's also a fellow of the American Academy of Nurse Practitioners and won an AANP state level award for her efforts in Utah based on vaccines. So we're very excited to have both of you here tonight. I'm looking to see if I see Lacey on the call yet. If not, I think we'll start with Laura. Are you able to, is it made so she can screen share too?
Yeah, let me see if I can, and I'm going to apologize in advance. I have a very stubborn cat that insists on bombing my Zoom call sometimes, so you will probably hear everybody meet Annabelle, so you will meet her sooner or later. The fun of working from home. And can you all, is that working, Michelle? Okay, I'm going to give you a quick run of 2 advocacy passions of mine. And the first of them is youth substance use. And youth substance use prevention is probably one of the most misunderstood areas in pediatrics. But 90% of all people who suffer from substance use disorders, it doesn't matter what the substance is, 90% began using a substance with addictive potential before the age of 20, usually before the age of 18, peak between 14 and 16. So that really makes preventing addictive disease in the United States of America soundly a pediatric issue. And we get very little training in it and very little information about it. So I'm going to give you just a brief run through of my substance use advocacy, and then I'm going to spend a couple of minutes talking about nursing and professional policy. So any
Um,
use.
Laura, just a quick note. I don't think we can see your actual presentation. I think all we're seeing right now is just your files.
Oh, let me just see what you're seeing. Let me stop sharing. How about that? You see a big red slide?
Yep, now we can see it. Thank you so much.
Oh, you're welcome. Thank you for letting me know that. So any use of any substance abuse while the youth brain is developing disrupts normal development with probable and increasingly certain long-term consequences. Now, one of the myths that exists that healthcare providers are just as apt to believe as the rest of the population is that youth substance experimentation is an unavoidable rite of passage, and all kids are going to experiment with drugs, especially the easy and most common ones to get: alcohol, nicotine, tobacco, and marijuana. The facts could not be any more opposite than that. Since 1976, and this is trends on the national surveys of drug use and health, that we have had back in 76, we only had about 20% of 12th grade students who had no drug use in the past month, and about 5% that had no drug use in the lifetime. And when we get to 2018, we're up to over 50% of high school seniors with no drug use in the last 30 days, and over 30% with no lifetime use. So one of the things we need to be really concerned about when we talk about youth substance use, among ourselves, we talk about rates of use that are concerning. But when we're talking to our kids, what we want to do is norm the majority. And the good news is the majority of young people are really making good decisions about substance use. And more of them are making those good decisions. So that's the peer group we want them to emulate. So instead of talking about the minority of kids who have concerning use, we want to talk about the majority of kids that making good choices, and that's the group you want to be a part of. So the other problem is that youth substance use is often undetected. Surveys of health professionals have indicated that between 33 and 43% of pediatric and only 14 to 20% of family practitioners actually routinely screen their adolescent patients about substance use. And if it is in the 11 to 14 age group, they're asked even less often. But according to the last national survey of drug youth and health, the overall unmet need for intervention of 12 to 25-year-olds with concerning substance use was over 88.5%. So we are missing 80% plus of kids who have concerning substance use that puts them at risk for substance use disorder later on. Now, one of the things, if I had a wish for everybody on this call, is that if you are not now screening every child at every visit for substance use, and at least formally screening them at every adolescent check starting at age 11, please do so. And the AAP recommends this questionnaire. This is an updated questionnaire. The CRAFT has been around for a while, but there's a CRAFT plus N questionnaire, and it's one of only a couple of screening tools out there that actually asks about nicotine. And you'll see the red highlighted area there. Was there any use of a vaping device containing nicotine or any other tobacco products? And it names all of the variety and the continually expanding variety of smokeless and smoked tobacco products. So that is my wish, that when you are seeing your youth, you are asking them about substance use, you're using a validated screening tool. The CRAFT can be completed by a patient before a visit. And if there are any positive answers, it has a second part that will help you determine whether there's a need for some behavioral interventions or occasional referral. So that's my quick little 5 minutes about substance use. Now I'm going to switch gears on you, and I want to talk about advocacy basics. And I know I see it a lot. We talk about how more of us need to be involved in policy and politics, and I can see the eye rolls in some cases, although those of you on the call are more interested than the average. But we really need to be able to leverage the power of our numbers. Nurses are continually in the top of the most respected professions and in the bottom of professions that are considered health policy influencers. And we need to close that gap. And my soapbox on that tonight is that those of you who are on faculty positions, we need to begin teaching policy in our beginning nursing programs at the undergraduate level so that students understand this is a part of their professional life and not an add-on when you get the policy course the last semester of your DNP or BSN program when you're working on your project or writing your thesis, and paying attention to that policy class is the absolute last thing that is on your priority list. So advocacy basis for everyone. Policy is a long game. You have to measure your success in doing and continuing the work, not to get discouraged if you don't get the results you want in a particular legislative initiative at a particular session of either your state or federal legislature. So and a lot of times the failures of today actually create the foundation for the successes of tomorrow. There is power in being a constituent. And I'm sure Dave will echo what I say with this is, when the lobbyists and the representatives of the associations and the industries come to Congress, yeah, they have a very important role to play with data and information. But when it comes down to casting a vote, elected officials at every level want to know what the people who voted them into office and the people who can vote them out of office think. We had a state call just a few days ago, and one of our long-term friends in the Georgia legislature came on and was bemoaning the fact that that because of all the virtual legislative, they are missing terribly any of the contact that they normally have with the physical contact, the in-person contact they have with their constituents, with the lobbyists, with their staffs, and are just absolutely hungry for contact. So writing a letter, making a phone call, trying to set a phone appointment with your elected official to talk to them about any child health or professional issue right now would be very well received. And like I said, numbers matter. We have tremendous numbers of nurses. We have tremendous numbers of advanced practice nurses, and we have plenty of NAPNAP members. And if we can just leverage the power of those numbers and own it, there's really not very much that we wouldn't be able to do. And, and I meant to erase this and I didn't, but it is a frustration that those of us that are in advocacy roles and positions and trying to convince and motivate other people that it just seems to be a pull. So in the question and answer period, I'd like to hear from you what some of your barriers are to becoming a more active advocate, and any hints that any of you on the call have that have been successful at being advocates have. So very quickly here in my last few moments, you need to know who your elected officials are and what level they serve. Communicate with them and share your expertise. Participate in their public events. Virtual is a great opportunity, and back in person when we get there. And everything you need is on the napnap.org website on the advocacy webpage, including how to find your elected officials, sample letters. And my personal rule is be known not only for your professional issues advocacy, for your advanced practice nursing advocacy, your removing barriers to practice advocacy, which is vital, but legislators get suspicious when the only time they see a profession down at the Capitol is when they have an issue. It makes us appear egotistical and self-serving. We are experts in child health, and they need our expertise. They need our advice to pass good legislation. So make it a point to be known for your advocacy on child health issues as well as professional issues. And when your state is considering a legislative campaign, here's just 5 quick steps. Legislative strategy, determining who holds the levers of power and how you gain access. Message development and communications, keeping everybody on track and on message. Allies and coalitions outside of nursing, who are the other groups that would have something to gain or would be willing to work with you on your goal. You have to worry about who gets elected, and try and elect people. More nurses would be even greater, but electing people who are going to be willing to support your causes. And also you can be strategic and plan how the campaign itself will help to grow and strengthen your organization and motivate your members. And with that, I will close. So thank you very much. It's a pleasure to be with you tonight. And I was really looking forward to this, because I know we've all missed our in-person conference, and it's great to at least see you all online. So thanks very much.
Thank you so much, Laura. That was wonderful and a great introduction for everyone. So now we're on to Lacey.
Hi, everybody. Let me see if can I share my screen?
You should be able to. I think Laura was able to. Yeah.
All right, there
Great.
we go. Okay, so I'm just going to expand on everything Laura just talked about. Her last 5 steps on how to initiate a bill is kind of what I'm going to go through, and how we did it here in Utah. So just as a quick background, back in 2016, I read a newspaper article that the school that my children attend had the highest number of immunization exemptions in the school district. And I was shocked by that. So I wanted to do something to try and fix that, but I wasn't quite sure what to do. So right after I read that article, I went to the NAPNAP National Conference, and I went to the Immunization Special Interest Group meeting, and I was able to kind of share my concerns. And then I had an awesome colleague that was like, hey, I'm here in Oregon, and our state just implemented a new law that requires parents to complete an online education module before they can claim an exemption. And I was like, I want to do that. I'm going to do that. I'm going to do that in Utah. I don't know how, but I'm going to do it. So I came back to Utah, and I basically sent out like a message on Facebook to all my friends. And I was like, so how do I pass a bill? Like, that's where I started from, like very bottom. I had no idea how to do this. So I just want you to know that if you want to make a change in your state or in your area, you can definitely do it. It just takes you wanting to do it enough to make it happen. And so through my experience, I have kind of created this acronym to talk about the different steps that we took in our state to make this bill pass, or to help change and pass this bill. So using the acronym CHANGE, we'll go through each of those steps. So C stands for collect data. So what I did was I just did a ton of research on how the immunization exemption rates were increasing in Utah, and there were tons of bar charts and graphs and lots of stuff that the state already develops that I was able to get a hold of, and then kind of create this like an image that this is a problem. We have a problem in Utah. Something needs to change. And so I was able to collect that data so that I could make a case for why we needed to make that change. And then again, just looking through all of the data, showing them stuff from or collecting stuff from the CDC and the Utah State Health Department. I was able to show that 95% of our exemptions in Utah are due to personal reasons, and just stuff that would really ring true to people who are who find immunizations important and who are stakeholders in making sure that we have healthy kids in our community. And so after I collected all of this information, then I decided, like, how am I going to fix this problem? So I want to be able to say, here's a problem, here's my idea, what ideas do you guys have? And so H in the change acronym stands for Hinge. And Hinge is, this is how we're going to fix this problem. So I really liked this quote from Susan L. Taylor. It says, everything hinges on education. Without it, you can't advocate for proper healthcare. And that's kind of what our Hinge was on, was just, we're going to educate. We're going to educate our parents a little more about this decision they've made to exempt their children from vaccines. And we're going to teach a little bit more about what their responsibility is because they have made this decision. And so it required a lot of collaboration. We first started meeting with our local boards of health. And I just kind of called and invited myself to all of these meetings and was like, hey, I have this concern. I want to come to your next meeting. When is it? I'll be there. And I would just they just stick me into their agenda, and I would come and present on the information that I found and what my idea was. And then I would get a lot of feedback. So I met with the local boards of health of all of the county health departments in Utah. I met with the Utah chapter of NAPNAP and the Utah chapter of the nurse practitioners. I met with the PTA. I met with the Utah Medical Association. I met with a cancer organization here. I met with the list goes on, but I just would continually make appointments for anybody who I thought would be interested in child health in Utah. And I would show them this information, this data that I found, and my idea. And again, just getting all kinds of feedback. And a lot of people that I met with came back with, well, what are other states doing across the United States? What are other people doing to address this problem? And so we contacted the immunization managers across the state. And what we found was that everyone is doing something different. There isn't one set of rules or programs that are working across the state. We really don't have anything that was absolutely working. And so that kind of helped us to realize that we're on new ground. We're on ground that needs to be better researched, and we need to be able to implement some things to see if they actually work. And so we found that a lot of the states that were requiring parental education, education varied a lot, anywhere from like, here's a flyer that you can read and then you get your exemption, to you have to meet in person with a healthcare provider to get your exemption. So it varied across the board. So after collecting all of that data and information about what was going on across the country, we returned to all of these associations and just kind of updated them on all of the different things all the different information that we had found. And that's what that A stands for, is associations. You've got to, like Laura was saying, you have to reach out of the nursing profession. You have to be able to think outside the box. What other organizations, what other people are interested in your topic? For me, it was immunizations. Who really wants to make sure that our children are safe and protected from communicable diseases? And so that's kind of where we started. And then I definitely didn't do this alone. So the people who were helping me, my colleagues, Beth Luthi and Gay Ray, they were able to kind of bounce ideas off me, as well as who we should be contacting and talking to about this topic. And then the next letter in the acronym change is N, and that stands for negotiate. So this part was really difficult for me. I first contacted my representative and asked him if he would be interested in sponsoring a bill. And he was not. He did not want to sponsor a bill on immunizations. He's actually anti-vax. And so that was the first like shocking challenge to me, is like, oh, what do I do then? Like, if I'm not, if I'm a constituent, if he's not going to support me, will my senators support me? So I asked him and he said no, he was too busy. He had too many bills already. And so then I reached out to all of those organizations that I had already talked to. And I said, I'd let them know, hey, my representative won't sponsor a bill. Do any of you guys have a relationship with your lawmaker that they would be willing to sponsor the bill? And within 5 minutes of sending out the email, I got a response back. Yes. Representative Carol Spackman Moss, she is actually looking at running an immunization bill. She would love to sponsor your bill. So it was just because I had formed those relationships with those other organizations, I was able to get stuff done so quickly, which was really, really beneficial throughout the entire legislative process. The other thing that I found when I was trying to talk and find a representative or a lawmaker that would be willing to sponsor my bill is that they needed to understand exactly what it was that I wanted to do. Because when you are drafting a bill, and this is all stuff that I learned along the way, but when you are drafting a bill, there are words that can change the meaning of what you're trying to do, such as shall and may. And I didn't really understand all of that, but the legislator did. And so for me to be able to clearly explain what I wanted to happen, and for the legislator to be able to say, okay, then this is what words need to be in the bill. It was a great collaboration. And along with that, we were able to sit down with members of each of those associations that we met with prior, with the legislator, and they have attorneys that help you draft the bill to make sure that everything is correct in the way that you want it to be. So we sat down with the attorney that was drafting it, we sat down with the legislator and all of the different representatives from the organizations to make sure that the wording in the bill was exactly the way we wanted it to be. So for us, the bill was House Bill 308. It required completion of online education prior to exemptions. It increased the frequency that they had to do the education. And then it allowed parents to have their kids in school for 3 weeks while they went and found their immunization records or got their immunizations. So it did have a, these are the things that the bill did. It was really exciting. So this is something that I learned along the way too, with numbering a bill. So once a legislator decides to sponsor a bill, they have to put in like a bill ticket. And then after your bill is completely drafted, like all the wording is drafted and approved and everything, then it finally gets a number. And when it gets a number, it's like so exciting, because then you have like something that you can refer to when you are asking people to contact their legislators to support the bill. And when you're talking to the legislators at the Capitol about the bill, if you have that number, it just seems like it's so much easier to start really promoting and advocating for the bill. So after you get that bill numbered, then it's really important to start rallying all of those organizations again. Okay, our bill's numbered. Now it's time to contact your representatives. We really need them to support this bill. This is what the bill is about. And that was really kind of a stressful time, because this is when the anti-vax movement here in Utah got word of our bill, and they started also ramping up their advocacy groups, and they were basically countering all of our messages. And that got a little frustrating. So it did take us 2 years to get the bill passed. So the first year it did not pass. But we learned how important that gathering support was after the bill was numbered. And so we ended up creating a Facebook page that had not only the representatives of those associations that we met with earlier, but also all of their members. So all of their members were a part of this Facebook group, as well as the representatives. And so we had about, I want to say it was like 3,500 members of our Facebook group that we called Why Immunize Utah. And that was really helpful because it allowed us to give really quick updates and call to action items, letters that were drafted already that they would just need to like put in their name and change the representative name on there, make it a little bit more personal to send it out. And that way we had like, it was more, it fit faster with how fast the legislative session processes. So there's changes that go along it changes all the time. It's really fast moving. And so you really do need that quick way to communicate with people so that they can reach out to their lawmakers. And that helped a lot. That allowed us to really ramp up our advocacy quicker. The other thing that you can do when you're advocating for a bill is during the legislative session, you can actually create flyers and your sponsor just has to sign off on the flyer. And then the lawmakers can have that flyer on their desks while they're voting on bills. So if you think about it, they have hundreds and hundreds of bills that they're voting on during legislative sessions. And so it's nice for them to have a quick reference to what it is this bill is about, why they should vote for it. And so we had these handouts that the legislators had right around the time that our bill was about to come up to be read and voted on. This is just another example of what we created for them. And then G on the change acronym stands for groups in support. So again, this is just more about making sure that you have a lot of different associations and stakeholders involved. And then that way we were able to say, when we were advocating for this bill, look, here are all of the different groups who support this bill. So that was really important to make sure that the lawmakers understood that this isn't just a Lacey thing. This isn't just a nursing thing. This is a lot of different associations who are very invested in this and want this bill to pass. And so it was important to continue to pass along that information as well. And then the last letter E in the change acronym, expect to be the expert. After our bill passed, I was still the point of contact for a lot of questions on how are we going to implement this and how is it going to work and where do we go? And it was a little, caught me off guard a little bit, but it was also really nice to be able to be continually involved in this process of changing the law so that we could improve immunization rates in Utah. And then the other part of that is I not only needed to know everything about vaccines, but I also needed to know how to respond to the anti-vaxxers' messages. And so it was really important to know both sides of the story so that when I gave my elevator speech to the legislators that I could very quickly rebuff or respond to the messages that the people who were against the bill were giving the legislators. So definitely needed to know both sides, backwards and forwards. And yeah, so that this slide, expert responses, that's just, again, applies to being able to know both sides of the argument for or against the bill. And this stuff about the anti-vaxxer arguments, I mean, it was just some stuff that was surprising to me that legislators would ask me about that when I first heard it, I was like, are you kidding? Like, I don't even know how to respond to that. So it was nice for me to be able to go back and do some more research and have a better response for those statements. And then also I was kind of shocked by some of the statements that legislators would say to me. For example, one of them said, I'm all for parental rights, let the people govern themselves. Once children start dying from diseases, parents will start to vaccinate again. And I was like taken back. Like, I can't believe that just came out of your mouth. But I needed to remember to take a breath and not get too emotional. So that was something that was really hard for me, because I had spent a lot of time, and this was my passion, and I found this to be so important. And so when I was giving my elevator speech to these legislators, and they weren't giving me their full attention, or they were kind of looking past me, or wanted me to, you could tell they were in a hurry, I would get kind of this frustrated, emotional feeling like, why don't you see how important this is? And why isn't it as important to you as it is to me? And the second year around, I was a little better able to kind of control my emotions and kind of be a little more practical with the fact that these legislators are dealing with so much, and that they just need the down and dirty facts and why it's so important. And then from there, they can make an educated decision on how they want to vote for a bill. And then, so yeah, the lesson, it's not personal, it's politics. You want to make sure you have a loyal lawmaker, because as the bill is being read, it can be changed on the floor. And then all of a sudden, it is not the bill that you wanted it to be. It could be something totally different. So you want to make sure that your lawmaker or your sponsor of your bill really understands what you want out of the bill, and that they will be loyal to that. They won't make compromises that are that you don't agree with, and that they are open communicators with you. And then also, you need help. This is not something that you can do by yourself. It is definitely something you'll want to collaborate with other people on. And so anyway, that's kind of that's the lessons I learned, and my experience about passing a bill. And it was really nice. It kind of created a platform and a nice base for us to move on. So this year we're now running a bill to remove the consultation and referral plan for nurse practitioners here in Utah, so that we can have full practice authority. And because of what we learned through the immunization bill, we were able to really build on those skills. And then we were also able to, we now have really great relationships with a lot of the legislators because of that. So that's it.
Thank you so much, Lacey. That's a beautiful presentation and so helpful in terms of just running through each of the steps in the process. So thank you.
You're welcome.
I don't know if anyone wants to provide any questions. I know we'll shortly move on to Dave Mason's presentation of updates from Washington, but if you have any questions that you wanted to ask Lacey or Laura before we move on.
Folks can put questions into the chat, or you can come off of mute and ask a question verbally if that's easier.
One question I had for both of you, just, I think you both provided some pearls of how you would go about, like going through the process of the legislative process, or how you kind of built those coalitions. But what was your favorite part, or what is your favorite part of being, the advocate that you've become and continue to be?
I think for me, I have a really strong relationship with my representative. I have his number in my cell phone, and he texts me during legislative sessions about medical related bills and asks me my thoughts on it. So I am viewed as a medical expert that he relies on for more education when it comes to health related bills. And I think that's amazing. And I think if more nurses were able to create those relationships, we could make huge differences in our healthcare system.
Great.
And for me, I actually had the opportunity early on in our Advanced Practice Coalition, when we were still raising money, to actually serve as our governmental affairs representative down at our state capitol. And that was a tremendous opportunity to build relationships that I still have. So, even it's kind of like a point of contact. It's still real gratifying that people, even from other organizations, will call me if they need some information about child health. And I still work very closely with our lobbyist, kind of behind the scenes, and still have some contact with some of the legislators that were our champions. So those ongoing relationships are really important, and it's really gratifying to be a part of legislative initiatives that you're not even actually spearheading. So it's immensely satisfying, even though it takes a long time sometimes to get a goal met.
Thank you both. I think that Michelle had put in the chat, can you maybe touch base on how you identified a policy mentor or somebody that you would, be your go-to person, for somebody who maybe hasn't had this experience or opportunity yet, but thinking of getting into putting their hat in the ring?
You could do what I did and just send out a Facebook message to all your friends. Or I think, I don't want to speak for Laura, but I think both of us would be more than happy to answer questions and help you through that. But definitely making sure that you have a good relationship with that person would be helpful.
Absolutely. And also, contact your state NAPNAP chapter or the special interest group that you're a part of, and find the people there that are interested in policy. We're usually not very silent about telling you who we are. And time commitment. How do you balance work advocacy? I see that in the chat box. You just start with the simple. And I know that we're all juggling so many balls right now. But again, and I see that Michelle put the link in the chat box too. We have everything you need to identify your legislator, sample letters that you can just fill out and personalize and sign and send in literally 60 seconds, responding to calls for action. The health policy groups, the NAPNAP sends those out rarely and only when we really need our numbers. And again, they're very quick and easy to do in just a few moments. So just starting there with the time you have. And as you get more interested and more confident, you may find that you can do things to keep in touch with your legislators on a regular basis with very little time commitment. And then those of us that really learn to love policy, we spend more time on it because it becomes a hobby and we love it. So I hope that motivates more of you to just start with the real simple, identify your elected officials and get in touch with them.
Yeah, something I didn't realize you could do is actually ask to meet with them, not during legislative sessions, but they actually want to sit down and talk to you. So you can actually reach out and just say, hey, I'm one of your constituents and I want to have a meeting with you. Can we meet for lunch, or can I come to your office? Or I've met with many lawmakers in their workplace, just for a quick 15-minute visit, and you just create relationships that way, and then they identify you when you're at the Capitol.
Yeah, and actually, off session is the best time. The best time to make a relationship with your legislator is starting a couple of weeks after the legislature closes, because that's when they have time during the session. Sometimes is actually now. They want to hear from you about bills, but our legislature can looks at about 2,500 bills a session, and once the session starts, it's just a treadmill for those folks. So actually, off session is when they're planning their legislative agendas for the next season, and they have more time and are very eager to meet with constituents.
Well, thank you so much both again. I know somebody, I think Nancy had asked in the chat, can we have a copy of Lacey's flyer? So we could certainly ask for Lacey to send it to us and we can post it on the health policy at napnap.org. And if there's any questions that you haven't had a chance to ask tonight, but you would like to, we again can take your questions and make sure that we get to them to Laura and Lacey to get back to you. So thank you again so much to both of you for your time and for sharing your expertise with us. We really appreciate it.